So the PR interval is usually between 3 to 5 small squares, यानी कि 120 millisecond to 200 millisecond, or you can call it 0.12 to 0.2 seconds as is shown here. Up to 0.22 is also acceptable. अगर थोड़ा सा बढ़ भी जाए तो it's fine, that's a normal variation. ठीक है, one thing. Second bit आ गई QRS, P के बाद QRS. अच्छा, just to remind you, Q और R और S क्या होता है? The first negative reflection after P wave is called Q wave, लेकिन जब वो high positive में चली जाती है उसको R wave कहते हैं. So Q और S whole complex should be about 3 squares. ठीक है, less than 120. That'll be normal. And then obviously there's a QT interval, and we'll talk about that later. So just two important, agar if you don't remember from this slide, is what's the PR interval, what should be the QRS duration. QT varies between males and females up to 440 to 460 milliseconds जो है वो normal है. अब 400 क्या होता है? This is 200, this is 400. So that's another way of learning. Okay, from the start of Q to the end of T, U को नहीं count करना है. From the start of Q to the end of T, if it's two large squares, then you know without even a calculator that it's about 400. But that's QT interval, not corrected QT interval. I'll come to the correction later. ठीक है, अभी basics पे काम करते हैं. So other important thing is where to put the ECG leads. अब depending on आप कहाँ काम कर रहे हैं, which sector, कहीं डॉक्टर ECG करते हैं, कहीं नर्सेज ECG करती हैं, कहीं टेक्नीशियंस करते हैं. बट आई थिंक इट्स इम्पोर्टेंट सबको पता हो कि ECG लीड्स लगानी कहाँ होती हैं. I don't know if someone is doing psychiatry here. UK में अगर आप psychiatry कर रहे हैं तो nurses को allow ही नहीं करते patients ECG लगाना, डॉक्टर्स खुद कर रहे होते हैं ECGs. So why is it important? क्योंकि if ये 3-dimensional picture अगर आप देखें, the heart is sitting behind the sternum and the ECG leads are on the chest. So ये chest fold की ECG leads बता रहा हूँ मैं आपको. This is like looking at something from a 3-dimensional perspective. ठीक है, तो if imagine these are 6 cameras looking at the heart from different angle. अगर आप कैमरे को गलत एंगल पे लगा देंगे तो it will look at the wrong part of the heart. So you will get an ECG which will look abnormal by mistake. So that's why it's important to know. और maybe part 1 questions जो होते हैं उनमें ये सवाल आता है where to put the ECG. So easy to remember. V1 जो है 4th intercostal space on the right side. V2 उसके exact opposite, 4th intercostal space on the left side. ये दो आसान हो गई. Then remember this line. This is a mid-clavicular line. उसमें you attach V4. तो V1 हो गया, V2 और फिर V4 पे चले जाते हैं आप. क्यों? क्योंकि V3 is just in between V2 and V4. Similarly आप anterior axillary line और mid axillary line उस पे आप V6 और V5 लगाते हैं in the same place, in the same direction as V4. तो this is just to remind you कि ECG lead लगानी important है सही जगह. There are limb leads as well. AVR, जो heart को looking from the right side. AVL, looking from the left side. AVF, looking from the bottom end. So depending on where you're looking from, you define which territory you're looking at. And why is it important? If you're not putting the ECG leads correctly, okay, you watch something from a slightly different angle, it looks slightly different. It's so subtle. And I can tell you, just by putting the ECG leads, let's going back here, अगर ये चेस्ट लीड्स की ECG गलती से यहाँ लग जाए सेकेंड इंटरकॉस्टल स्पेस में, you can